Hello students, this is the a video on the peritoneum. In this video I would like to trace the peritoneum within the abdomen. Here I would like you to trace along with me the this complicated structure. Here you can see this white line going up. It is covering the internal surface of the abdominal wall. So this is anterior abdominal wall, and here we can see this white layer. This is peritoneum and parietal peritoneum, as it is covering the abdominal wall from inside. Now look at this, the same, keep tracing it. It is going up, and here it is coming under the, this is diaphragm, it coming under the diaphragm here, and under the diaphragm it reflects upon itself and comes onto the end of diaphragmatic surface of the liver. Again, look, from under the diaphragm it folds and comes onto the surface of the liver, which is diaphragmatic surface. Then it covers the diaphragmatic surface of the liver, then it reaches the inferior border of the liver, then it goes under the liver on its visceral surface here. Then at the porta hepatis it is again reflected, and here it forms the lesser omentum, anterior layer of the lesser omentum. Now look at posteriorly, we have got similar layer here. This is peritoneum. Here it was parietal peritoneum. When it reflected onto the surface of the liver, it became visceral peritoneum, because liver is a viscera. And here you can see it reflected from the undersurface of the liver at porta hepatis, and it became the anterior layer of the lesser omentum. And likewise, as I said, posteriorly we have got, this is the parietal peritoneum covering, this is the pancreas, which is lying retroperitoneally, and aorta and this inferior vena cava. These all structures are retroperitoneal. And look at this thing, it moves upward, and from the undersurface it for a small distance it lies on the diaphragm. Then it reflects and becomes visceral peritoneum onto the liver. Then it covers the liver, and then it reaches the porta hepatis again and becomes the posterior layer of the lesser omentum. So this is anterior layer, this is posterior layer, this is lesser omentum. Now look at this, when it reaches the lesser curvature of this stomach, as you are looking at the structure from the lateral view, because it is median sagittal plane. Now look at this two layers, we had two layers here. The anterior layer, it passes over the anterior surface of the stomach, and posterior layer passes onto the posterior surface of the liver. And at the greater curvature, these two again layers, they join, not exactly join, but they come to each other, and two layers of peritoneum move downward. Then they reflect upon themselves and then start moving upward. So two layers became four here, one from anterior surface of the stomach, other from the posterior surface of the stomach. At the greater curvature, two layers moved down and they reflected upon themselves and then started ascending, and on the anterior surface of the transverse colon it attached. So here we have got posteriorly parietal peritoneum, and then this is mesentery. So this transverse colon has been invaginated from outside. Then here we have got small coils of small intestine. Then this parietal parietal peritoneum, it became mesentery, then visceral peritoneum, then again mesentery, then parietal, then mesentery. Then it became visceral peritoneum by curving viscera, then again mesentery, then for a small part it became parietal, then again mesentery. So likewise things are happening like this. Look here, this whole mesentery, as you can see, yellow structure, fat, blood vessel, arteries, veins, lymphatic, everything is in there. Then this mesentery, it moves up, then it becomes parietal peritoneum again, and this parietal, these structures which you can see behind are retroperitoneal structures. So pancreas, kidneys, suprarenal glands, aorta, inferior vena cava, and here you see parietal peritoneum, it reaches the rectum. In upper part of the rectum it covers anteriorly and laterally, in middle part it covers anterior, and inferior part of the rectum is devoid of peritoneum. When peritoneum reaches the second part of the rectum, then it is reflected upon on the bladder. As a result, here we have a pouch is formed. This pouch is called rectovesical pouch. In case of females, it is called rectouterine pouch or pouch of Douglas. So then from superior surface of the urinary bladder, it reflects onto the abdominal wall again anteriorly and ascends upward again from where we started, if you remember. So this is the peritoneal cavity here between these intestines, then here between these intestines. This is all, so it is not a simple cavity, rather it is very complicated kind of cavity. And these intestines and structures, they are hanging in the peritoneal cavity, but they remain outside the peritoneal cavity. So as a result, in case of males, this peritoneal cavity becomes a closed sac, whereas in case of female, through uterine tube, this pelvic cavity is communicating with the outside. So as a result, PID, pelvic inflammatory disease, in females is very common. So this is, and behind the stomach here we have got lesser omentum or lesser sac, behind the lesser sac or omental bursa, So this is omental bursa, and this omental bursa has got superior recess behind the liver here, superior recess behind the liver, and inferior recess which is present between the upper part of the greater omentum. So this was greater omentum, which is hanging like apron in front of the small intestine. It was formed because of anterior and posterior layers reflected of the peritoneum, visceral peritoneum, which fused or met each other again at the greater curvature. Then two layers became four here. So in upper part, so here you can see this is foramen of Winslow, or this is foramen of Winslow or epiploic foramen through this lesser sac and this all greater sac. This is all greater sac. The peritoneal cavity, rest of the peritoneal cavity is called greater sac, between the intestine, loop of intestines, between the loops of intestine, between the loops of intestines here. So this greater sac is communicating with the lesser sac through this foramen of Winslow. So this diagram is very much important if you want to have a good concept of peritoneum. And if you look at this thing, this was from the diaphragmatic surface, peritoneum was reflected onto the surface of the liver. Likewise, from the diaphragm, the peritoneum was reflected onto the surface of the liver. As a result, if you look carefully, this portion of the liver, it is devoid of peritoneum. There is no peritoneum, as the peritoneum has been reflected onto the undersurface of the diaphragm on both ends. So as a result, this is called the bare area of the liver. Bare area of the liver. So this was, a bit. I tried my level best to make you understand the concept of peritoneum. If you have any question, please comment.